High blood pressure is the leading preventable risk factor for heart disease and stroke, and the latest research has also found high blood pressure to be a significant risk factor for cognitive decline and dementia. American Heart Association volunteer expert Dr. Rachel M. Bond joins me now to share what women need to know about managing their blood pressure at every stage of life. So thank you so much for joining us. And the American Heart Association recently released, new high blood pressure guideline. So what do people need to know?
Yeah, so the American Heart Association with the American College of Cardiology, they released blood pressure guidelines. These are new guidelines since the last iteration of it in 2017. The first thing we need to know is what's a normal blood pressure. So normal blood pressure, which we should be striving for, is anything less than 120/80. Anything above that is elevated up until you get to the first stage of high blood pressure, which is a blood pressure above 130/80. And then there's the second stage, which is a blood pressure of above 140/90. As your blood pressure increases, unfortunately, your risk of cardiovascular disease increases as well. And because a lot of times high blood pressure could be very silent in the sense that there are no symptoms associated with it, going to the physician and the clinician and getting your blood pressure checked regularly is really your best bet at preventing anything bad from happening.
Wow. So tell us about blood pressure and pregnancy. What do those women need to know?
So one thing that the American Heart Association wanted to do with these blood pressure guidelines was talk about different checkpoints in a female's life that could overall impact not just their pregnancy, but also their future cardiovascular health. One of those checkpoints is pregnancy. When we think about pregnancy, we know that with hormonal changes, a lot of times it can be perceived as your first stress test. Increases in blood pressure can occur, increases in heart rate. And if your blood pressure gets to a point where it's high enough where you may require medication during your pregnancy, you're actually at a 2 to 4 times greater risk of having high blood pressure outside of the pregnancy. And you're also at a greater risk of having future cardiovascular events up to several decades after the pregnancy. So telling your physician about your pregnancy history in a detailed format is one way we can best manage you and lower your overall risk of heart issues as well as high blood pressure.
Wow, that's really crazy to know that even decades later can be an issue. So what actions can we take to minimize those risks?
So there are several options. One thing that the guidelines also highlight are individualized care. Yes, of course, there are a select group of people that may require medications, but also every single person can benefit immensely from lifestyle. When we think about lifestyle, that's 150 minutes a week of getting in some degree of moderate walking, even walking at a brisk rate. We know that limiting your salt intake and eating an overall heart-healthy diet, which includes healthy fats and limiting those bad saturated fats, that could also lower your blood pressure. Getting enough sleep, 6 to 8 hours of sleep is what the American Heart Association recommends, and making sure you avoid any toxic things like nicotine, excessive alcohol use. All of those things can collectively lower your chances of not just having high blood pressure, but better managing your overall cardiovascular risk.
Well, speaking of managing, you talked about ways that we can kind of limit that risk, or how do we manage it though? Like, let's say we've got it at a good level and we want to keep it there.
Yeah, so the majority of the patients, once they're diagnosed with high blood pressure, a lot of times our goal is to keep your blood pressure above 130/80. However, it's very individualized, and the way to keep it there is regularly going in for your checkup. Also, the American Heart Association now is recommending that people invest in a home blood pressure machine. There are websites, one of them being validatebp.org, that gives you all of the validated machines that have been approved by the FDA as well as some of the other medical societies. That way you can see what your blood pressure is in your normal habitat, not just in the doctor's office, but at home. And that gives us a better understanding of how well we're managing your blood pressure.
Yeah, and then you can kind of see the trends, right? So give us that website one more time where we can go for more information.
So that website is validatebp.org, but the American Heart Association also has a website, which is www.heart.org or www.goredforwomen.org/high blood pressure. And that specific website is for women to understand their future cardiovascular risk.
Wonderful. Well, thank you so much for telling us all about this today. Very important stuff.
Thank you so much. Have a wonderful day.
Thank you. You too. And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.